Hi, this is Dr. Sharif Muhammad. I would like to take you through one of the recent incidents happened in Kerala which got widespread media attention and criticism. So I want to talk you about what happened there in real and how the media have twisted the news for their political gains or maybe to get their news to be circulated widely. It happened in Vilappilshala CHC, one of the public hospital in Trivandrum district. A patient reached there at midnight, I think in between 12 o'clock and 1 a.m. with an acute chest pain. Patient was accompanied by with his wife. So this was the scenario, and what media is saying that the patient was denied the treatment and even the gate was closed for that particular patient. It is literally the news heading circulated or the popped up in our social medias. So it got a lot of criticism because the heading itself was emotionally catchy, and our health system, the Kerala health system, well known for their services, the quality services, and we are celebrating it as one of the number one healthcare system. So by looking into a political angle of this news, of course it will get a good circulation because we are saying that our health system is good, and if a patient is coming to hospitals, the patient supposed to get ideal treatment and to be managed ideally from that particular institution. So media twisted this news entirely to get this wide attention and the emotional catch. So let's see what happened. The patient reached the hospital, as I said, in between 12 and 1 a.m. And if you see the CCTV footage, which was also circulated in some of the groups, and within one and a half minute, patient was diagnosed with the available doctor there, and they have found out that the patient can't be managed within that CHC. People need to understand our healthcare infrastructure, how or the services have already been classified according to the services they can provide. Like we are having the primary healthcare center, secondary and tertiary and specialty centers. Like these primary hospitals or the primary healthcare services can only provide some of the basic management services, and if they found out that they can't manage any patient from their PHC or the primary healthcare services, they have to refer that patient. So within the golden time itself, they have to refer the patient. What the CHC here, the Vilappilshala did is was like they have arranged ambulance to transport the patient to the tertiary center. Unfortunately, the patient died while carrying inside the ambulance. So that also the media was saying that even any doctor or the nurse haven't accompanied the patient in the ambulance. So that's not supposed to be like if you are looking in a system level perspective, like in the midnight the human resources available inside the hospital will be very less, and if any other patient come in that time, they can manage, and if the nurse or doctor accompany this particular patient. So acknowledging the pain of the family who lost this patient, we can say that at least they are saying it out of their emotion. But media is not like that. Media have all the guideline, media is having all the information, how patient need to be managed or how the patient needs to be carried to a tertiary care center, what is the indications for the reference. So they are hiding all those facts and celebrating the news for getting some news value or some circulation for their news. This is what happened in Vilappilshala, and unfortunately the patient died while carrying to the tertiary center. So the only system level criticism that can be drawn reasonably from this incident is that the knowledge gap and the health seeking behavior of the community. Of course, that is the responsibility of the system to adequately train the community to access adequate treatment. Like in a highly informed or highly health educated community, they would have carried the patient directly to a tertiary center without any delay. Even in this case, the patient had a referral 3 days back and they didn't go to the any tertiary center. I'm not sure about the reason for that thing, but still that is a knowledge gap exists. That is the indication that there is a knowledge gap exists. In a well-informed and health-educated society, the patient would have been taken directly to a tertiary center without any delay. Here, the patient went to CHC first, and then they have been taken to a tertiary center. That itself showing some delay in terms of the care delivery. So these kind of criticisms the system can take. But what media is doing is like some unnecessary politics here, and they are not even adhering to the protocol. That is what I wanted to convey here. At the service delivery level, the CHC acted appropriately and in accordance with the existing protocol. The media organization must uphold their ethical standard while reporting sensitive, emergency, and public health incidents. This is the core message I wanted to convey today, and thank you for watching.